on one of your websites or one of the sites about you mentioned bariatrics. So is that something you get involved in? Like, do any of your patients, for example, undergo any sort of weight loss surgery?
Somebody might have just said bariatrics because the department that I work in is the bariatric department. And so we work alongside the surgeons because there is such a high weight regain that happens after surgery with anybody, you know, regardless of surgeon, regardless of where you go, regardless of the surgery that you get, whether it's like a Roux-en-Y or a gastric sleeve, there's weight regain. And a lot of that has to do with nutrition because you have this tiny little stomach. And even if you have, you know, pizza and cereal and cookies and you know, crackers, you might get nauseous if you try to overeat or have dumping syndrome or have like these adverse reactions to eating too much. So your calories naturally go down, maybe your total carb count naturally goes down and the weight comes off because of all of the, you know, hormonal improvements that come with gastric bypass. But then 18 to 24 months after the surgery, your hormones start to shift back in the other direction. You might have some, you know, expansion in the size of your belly. And if none of your dietary habits have really changed, like if your nutrition hasn't changed overall very much, then weight might start to come back on. And so working alongside bariatric surgeons is actually really helpful. It helps the patients who underwent this huge procedure only to backtrack 18 or 24 months later. So I do see a lot of post-op bariatric patients, try to help them get the weight off again. And I end up teaching them something that they had never learned to begin with.
Mm-hmm. So, and with these surgeries, how about nutritional deficiencies with these surgeries? Because that's another common thing. Because nutrition isn't fully absorbed.
It's true. The sleeve is the most common like gastric surgery these days, and the nutritional deficiencies are not as bad or severe as like you know, the Roux-en-Y, which was the procedure from 10 to 20 years ago that was most popular. So they happen. They're not as bad. People are mostly on like multivitamins. They have to be sure to supplement like the fat soluble vitamins and make sure that they have kind of a robust dietary plan that includes lots of vegetables if they want to avoid supplementation, but supplementation is advised for basically every patient. And yeah, working with that is important too, because we kind of have to keep an eye on vitamin levels over time, in addition to counseling them on dietary changes. I do also prescribe weight loss medications. So I'll often use drugs like metformin, which is a diabetes drug, to help lower insulin levels and decrease some of the cravings, decrease blood sugar. And then there are the newer GLP-1 agonist medications, the injectables. And honestly, a lot of patients who have undergone bariatric surgery are extremely interested in weight loss medications. That seems to be my most popular crowd when it comes to like that desire for medication. And I think it's like, you know, it's people who went through something major and now they like need another major intervention and they can't go back to surgery. So they want something like prescribed for the weight loss. But at the end of the day, I always make sure to counsel people on nutrition because that's the most important part. There's no magic pill or shot that will just like make you eat whatever you want and lose 25% of your body weight. Like if that existed, I would be on it.
Or the slimming juices and you know, drink this juice instead of food for a week. And
if only, right?
It all comes back.
I know. If only that existed. I wish it did.
Mm-hmm. But I think generally people look for that magic pill for everything, not just weight loss, but you know, my blood pressure is high, my blood sugars are high, give me the magic pill, and everything will be better.